Anyway, good morning, and we'll continue with the class. So, as usual, before I start the topic, we'll quickly understand what exactly you understood in the last class, and then we'll try to have a small continuity. So, Silicea, if I'm right, we have spent 2 hours or 3 hours? 3 hours, okay. I mean, number of hours will not matter. But anyway, what is very important is you need to understand whatever is told. Okay? So we'll have a quick recall of what was discussed in the last class and then we'll go ahead. Okay? So I hit the particulars. Okay? Meaning we started with introduction about Silicea, sphere of action, ailments. How do they look? The physical appearance. And I told you about the ailments from the mind, the mentals, the characteristic symptoms and the particular symptoms. Okay. Now what did I tell you in the particular symptoms? We focused on few key areas. Particular symptoms. Symptoms pertaining to the body. What were those key areas that we discussed? I know you have your periodical assessment tomorrow. But what was told, you should remember it very well. So we started with head, if I am right. And what did we discuss on the head? I mean, that's the small recall I wanted. Okay. We spoke of what under head in Silicea. We spoke of headache, very good. What was the area, or which was the area where you saw headache in Silicea? Headache, really. Headache mainly starts in the occiput and slowly settles over the right eye. That was the location. Right sided or left sided? Very good, right sided. Okay. What else apart from headache? We also saw there is a lot of hair fall in Silicea. What was very peculiar about hair fall in Silicea? Very good, beautiful, agreed. Good, I like that word. Premature balding. And how do you conclude that? I use a word, a peak was shown where a young man had lost a lot of hair. So, baldness in young people, premature balding, absolutely right. Baldness in young. And again, a very good remedy for hair fall. Very good remedy for hair fall. Okay. And we also saw sweating. We also saw eruptions. What type of eruptions? Pustular eruptions. Very good. Pustular eruptions on the scalp. Okay. Now, amelioration of headache in Silicea. By passing urine. Correct. That is your word. But the word I wanted is profuse urination. They have headache and when they pass urine, they feel better. It can be a question in your upcoming periodical assessment. Okay, it can be one of the questions. Don't read only this and come. Okay, we need to assess you for 10 marks. Okay. So, amelioration and what is the action of Silicea and liver? Very good, suppuration. It causes abscess, hepatic abscess, or it can also cause inflammation. Inflammation and hepatic abscess are two things you see in Silicea. Okay. Going ahead, what is the action of Silicea nails? Nails. Nails gets. Okay, there can be pus. We use one word. What is that condition that can happen? Phelon. In our local language, I told you the word we use is Ubursultu. Okay. So phelon. And the nail can get crippled. Okay. And there can be white discoloration on the nail. These were few things. And I also told you in detail about the GA symptoms. And the main focus in GA, the focus there was constipation. If you remember, I told you the rectal complaints of Silicea. Okay? Rectal complaints of Silicea. So what was very characteristic? Okay, there is fistula. I have got nothing against fistula. Good fistula. Stools have to be removed mechanically. See, I mean, these are all very important symptoms. You cannot afford forgetting. So tomorrow I have test, another test. I mean, that cannot be the excuse. Okay? But these are very, very, very So stools which needs to be removed mechanically, Silicea. And one more very important thing we discussed under rectum was, what is that word I used? Receding stools. Stools coming and going back. Okay? Stools coming and going back. Receding stools. Okay. So in today's class, next 20-25 minutes, we will focus on a very important topic. And this is all about Silicea child. See, when I started Silicea, I told you Silicea is a very important remedy acting on children. Okay? Can you recall that first few slides? I had shown you, shyness will come a little later. I had shown you the evolution of the child, an infant, okay, who is growing. And Silicea has a very good impact on the growing infants. Why do you think Silicea has an impact on the growing infants? Okay, fontaine is good, agreed. But what is the key word? First class of Silicea. It mainly affects the nutrition. It mainly affects the assimilation, absorption of the nutrients, and it indirectly reflects on the growth. Okay. So Silicea is a very good remedy acting on children. So in today's class, we'll try to understand how a Silicea child will be. For your exams tomorrow and for your practice in future. Okay. In clinic, how do you identify a Silicea child? Okay. So now, we've already done this. I've given you in bits and pieces. In this class, we are making an effort to put them in an order. Okay? So under what headings you want to describe a Silicea child? We have plenty of headings. Okay? Now any quick inputs, what could be the probable headings under which Silicea child can be described? And remember, kids, they are main, tomorrow when you look at your practice, majority of the times it is kids, who are brought in to our clinic. Because our pills are very sweet and we don't harm them, we don't vaccinate them, we don't inject them. So many times kids are also very happy coming to us. Mummy, take me to that sweet uncle, take me to that sweet auntie. They may not be sweet, but what is the child's impression? We give them some sweet balls, sugar balls. Take me there, meaty goli. वो अंकल के पास लेके जाओ, वो आंटी के पास लेके जाओ. So practically it is very, very essential for you to understand the kids, their psychology, and how our homeopathic remedies are. If you understand this, tomorrow you can very effectively apply them in your clinical practice. Okay. So how do you think a Silicea child will be? Okay. So can we have some headings under which you would like to discuss? Okay. Mind. Before mind. Okay. Mind includes behavior. Good. Very good. No issues. Appearance. Good. So the physical appearance. That can be a part. Okay. So how do you think a Silicea child will be? How do you think the Silicea child will be? Physically. Physically. We have discussed this. Okay, go to lean thin. Then. What will it happen? Good, very good. See, what we are doing is, what we have studied, we are trying to apply. So Silicea child is lean thin. And generally they have quad belly. Good. What else? Good, beautiful, agreed. Large head. Boys, don't worry about tomorrow's exams. Focus, live in the present. Fontanelles are open. Fontanelles are open. They are not fused. Okay? Fontanelles are open. Good. Now when you look at mind, how is the child? Okay, your CR says yielding. Very good. Shy. Good. Now how will you identify that the child is shy? Do you think the child will come with a t-shirt? Hi auntie, I am shy. Hi uncle, I am yielding. I have something behind also, see. I mean, how do you identify? That is very important. What is it? Very good, beautiful, but this is what I wanted. See, when you mean to say shy, because tomorrow I will be talking about, tomorrow means the next somebody I am talking is also shy. Then the confusion will start. Sir, two remedies. Two remedies, two kids, one shy. Sir, how do you differentiate this kid from this kid? Okay. So even in shyness, each child has its own way of expressing shyness. Okay. Now what does Silicea do? Silicea is very shy. Silicea is very timid. So when you ask some question, or he has to tell you something, what will he do? He will go to his mother and something you tell his mother's here. And mother will tell, sir, this is what he feels. This is what is complaining about. Okay, so this is less courage. This is shyness. So very good. Shy, less courage, beautiful. Anything else? Whispers into mother's ears, only remedy. Tomorrow in your clinic you see a child. When you question or when he wants to tell you something, he is using his mother's ear as a medium. He is going and telling something to the mother, and mother in turn tell to us. Only remedy in our material medical is addiction. But how many of you are lucky that you will get all children will go and whisper into Madam, I know Silicea very well, so please go whisper into your mother's ears. It will not happen. So there is something voluntarily the child does out of shyness. That is Silicea. Very good. Anything else? Mind. Stubborn, good, yeah, they are very obstinate. Obstinate children, hata, stubborn, ziddi. Good, ziddi, stubborn, obstinate. Huh? Giving nature, yeah, that's what your CR was trying to tell. Yielding. A girl has something, some toy. Many times boys give. So you mean they are Silicias? You told giving. You would have also received so many things in the past. Do you think they are Silicias? Why they give is also very important. Silicea can't say no. The other guy is creating an impression with the girl. See, I am giving what you are asking. You can take me a little seriously in future. He is giving an indication. But Silicea generally cannot say no. Though he is stubborn, though he is obstinate, he is very yielding. Good, I like it. Yielding, obstinate, what is it? Bashful, shy, whispers into the mother's ears. Good, anything else? Good. Yes, when you talk of fear of exams, little elderly kids, fear of going to school or fear of exams, good, possible. LKG, UKG. Now, many schools they don't have exams, but okay, fear of exams. Fear of pins. Child collecting pins. With the fear that it might hurt him. So, pin mania. Good, agreed. Huh? What is it? Night walking, good, very good. Yeah, possible. Kids walk at night. Did I share a case? We had a patient, who was studying in a very reputed school, and never the parents have sent him for trips. Never they have sent him for trips. The genuine reason why he was not sent to trips is because he has this bad habit of night walking. And in one trip, 10th standard, last trip, he wanted to go, and they came to me telling, sir, there is a night train journey. The trip schedule has a night train journey. What if this guy walks in sleep when the train opens the door and he's not literally jumping, he's walking. And what if he walks, only child, only son we have. And we are not sending him because of this genuine reason. Now that is night walking. Good. So there can be night walking in children. Possible. Fear, anything else. Seven. One very important thing. Silicea is a very intelligent child. Okay? So intelligent, and we also saw that they are very missed classes. So many are missing today. So they are not Silecias. See, I mean, not just because you are all here, you are not Silecias. But Silecias generally are very studious. They don't miss classes. No? Studious and good boy. Good boy image. Yeah, sorry, good girl. Okay, I'm sorry for that. Don't mistake me. Good boy / girl. I'll change, sorry. So, good boy, good girl. At least in BHMS we should have had good girl. Okay, anyway. So, good boy, good girl, always studying and learning something. See the beauty. Learning something at any age. He is student for life. Beautiful statement. What is this? He is a student for life. 50 years, 45 years, 60 years, 70 years, something new. He's got that desire to learn something new. Student for life. Not student of the year. Student for life. Meaning he's a student. Entire life is a student. Okay? Student for life. And if you just see this here, very, very sensitive, very mild. Very sensitive, very mild. And I told you, they're very intelligent. Okay? And very good at studies. Very good at studies. They're hardworking. Silicea child, the moment he goes home, he will just freshen up, wash, have something and start with his books. Very rare and lucky parents. Silicea. Okay? So you need not force them, they do their job, they're very good, and this is what we saw. And what did we conclude in the end? That they're very shy. They're very shy. Clings to the mother, child will always take the hand of the mother. Okay? This thing in Silicea is out of shyness. Out of shyness. Okay? See, this is how they will come into our clinic. I'll be telling a remedy in the next class, beautiful remedy. They are always behind mother and they will looking like this. They will peeping from mother's legs like this, or through hands they will peeping. That is how they are in clinic. You call them, beta idhar, come, hello, hi. You are trying to make an eye contact, you are asking them to come, oh no, suddenly they again go back. And then again they will be, looking. So, that's a different remedy. I'll talk about it. But we need to understand, Silicea can be very shy. Silicea can be very timid. Yeah, now this is what you told me, that this is, what is this? I told you, like anything you ask, Silicea can't say no. It might be his favorite thing. Chalo, aapne pucha le lo. Fine, they give. Okay? Very yielding, timid. You see, child, how is he entering your clinic? Holding mother's hand. Okay? Many times in clinic, mother will be running behind the child. Mere ko pakro. That, they're very restless, they're very energetic, hyper children. Silicea, see, if you just look at his face, many girls will be having a feeling, wish I get a boy tomorrow like me. As a child, don't mistake me. So meaning what I was trying to tell you is, just looking at his face you can make out he's very mild, and very good boy. See, they are not holding his hand. He is holding their hand. Everything matters. हम आपको बैग पकड़े या आप हमको पकड़े. Very important. He is out of shy, out of timid. He is holding. They are not holding. Many times kids are so hyper. Parents they hold. अगर इसे छोड़ेंगे ना, खत्म. So they guard him. They hold him tight. Silicias are not like that. They are well behaved. They know what to talk, where to talk, what to do where. Everything they know. So that's why we conclude telling good boy, good girl. Many times in the end some child comes to your house, we certify, kitna acha bacha. Right? Sometimes we make the mistake of telling in the beginning. And in the end we realize we made a mistake. And Silicea still end, they maintain that image. I am the best, I am the good boy, I am the good girl. Right? So very obedient, refuse to answer, instead disperse check around आपको, right? And once they get convinced, they slowly come and they get themselves checked. So that initial recovers. The next time they know you are not harming them. Uncle, मेरे को इधर रुक रहा है, इधर, please check around them. Right? So they volunteer. They can be salacious. Okay. So in the next thing, you also see is children who can be obstinate. Yeah, this is what I was trying to tell you. Mild yet obstinate. Okay. And there's a lot of anticipation. What is the image I have put here? What is the image I have put? Can somebody quickly interpret the image? First day of school. See, this is the play school. First day of school. Can you look at his face? There's so much of kya hoga andar. No, it's not curiosity. Curiosity will not be like this. Curiosity will be like this, I mean, everything will be high, ears, eyes, and your all antennas will go up, and you're very curious to know. And this is not curiosity. It is out of anxiety. It is out of anticipation. What is waiting for me? Fine? What is waiting for me is a feeling. So anticipation, and then you also told me that, fear. We missed this. There's a lot of stage fear. In spite of studying well, in spite of being an intelligent guy, he has fear of exams because of this thing. There's a lot of anticipation. Will BK sir ask questions from Silicea, or will he ask questions from Ruta, or will he ask questions from Arnika? You have studied everything, but क्या पूछेंगे? ये आदमी क्या पूछेगा? Right? Okay. So that will be the tension. So examination fear of stage, fear of sharp things, and fear of pins. Okay. And somebody rightly said, there is also somnambulism. That is night walking. Okay. Now this is the typical Silicea appearance. Head will be large. Yeah, you told this head large, don't limit here. You should also add open fontanelle, distended abdomen, hard distended, and wasting of the body, especially legs. See, wasting means the muscles would have become thin. So generally what you see is Silicea will have thin extremities, pot-bellied abdomen and a large head. Remember, in clinic this is how they come. And you should not miss this particular picture of Silicea. Okay? So we'll go ahead. What could be the probable ailments in Silicea? Child. We're talking of child. See, till now we spoke of child, his mentors. We spoke of physical appearance of the child. Now, in the first class, I have given you a lot of ailments, lot of positive factors. You as a first year student decide what could be those probable ailments which can come only for a child. Okay, malnutrition, we'll come to it a little later. Ailments from. Malnutrition can happen in Silicea because of malabsorption. Okay, malabsorption. He's eating, he's drinking, but it is not getting absorbed from your physiology knowledge. What would be the common ailments? Very good, was that? Vaccination, beautiful, good. Examination funk, okay, possible. No, we're talking ailments from. Causative factors. Constipation is the result. Okay? No issues. First year, you will have to, understand. 2 or 3 more classes, you will fall in line. No issues. See, ailments from is clear. Ailments from means causation. Okay? Causation. Yeah? So it could be like, for example, vaccination, it could be examination fear, or over-exertion. Besides Silicea ailment, I have shown you mental exertion, overstudying, over-exertion, exposure to cold, or what is this? Suppressed skin eruptions. There are some skin lesions, skin issues. You are putting ointment and you are trying to suppress it. So these are few ailments which can cause complaints in Silicea child. Okay? Yeah. Now what could be the Physical problems. See, till now, we are told, or we have discussed the mind, we have discussed the physical appearance, we have discussed the ailments. Now we are looking at the particular problems from head to toe. What problems a Silicea child can have? Keep this point in your mind. A Silicea child can have. So what are the problems a Silicea child can have? Head to toe. Head to toe. He can have headache, okay. Headache, right occipital to right leg possible. Then anything else? Jura. There can be hair fall, yes. Okay, there can be eruptions on the scalp, beautiful, good. Anything else? See, go back to the sphere of action. It mainly acts on the glands, lymph glands. Okay. So like for example, what you see is a very good remedy for ear pain. Ear pain which comes from exposure to cold air. Ear pain or child crying with pain in ear. Child crying with pain in ear. Pain in ear, child bores into his ears when asleep. Okay. So child bores either his finger into the ears. Okay. Boring, you understand? Boring, right? Boring. So he bores his fingers into ears when asleep. Or you can also talk about all these things. What are these things? These are things which will happen in children. You have a limitation because you are a first year student. As you come to second year or third year, you will try to understand things better. But now you also need to realize that Silicea can be a very good remedy for tonsillitis. Tonsillitis, okay? Tonsillitis and what else? What else? Very good ulcer, good, something beyond ulcers. No, in throat, in tonsils. Okay, good ulcers should cover. We use one word when I describe throat. Circulation, good. So there is a word called as quinsy. 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 When you have pus in the tonsils, peritonsillar abscess. When you have pus in the tonsils. So now this is how it looks. See, understand the difference between this image and this image. What do you see here? The tonsils have become red and it is swollen, inflammation. What do you see in the second picture? There is pus. This is what we call it as quinsy. So, in children, there can be inflammation of tonsils or there can be pus formation in tonsils. Okay? So, going ahead, desires, aversions. What do they like? Very good. They like cold things. They like egg. They like ice creams. And they like raw vegetables. Can you see this smile? Can you see how nicely they are enjoying? What are they enjoying? Raw vegetables. If mother cooks the same and gives, egg. No, I don't want. So they like more of raw vegetables. Good. And you rightly told they like ice creams and they also like eggs. What Silicea doesn't like? As a child, infant. Very good. That comes first. I don't have to put that. What it doesn't like this one. Now this is very important. Infant has an aversion to mother's milk. And mother will be emotionally hurt. Son is drinking cow's milk. He is drinking packet milk. He is drinking formula milk. But my milk is not able to drink. Is what mother very emotionally feels. Okay. A dose of Silicea to the mother or to the child? Child, don't give to the mother. A dose of Silicea to the mother, to the child can make a lot of difference. So aversion, cooked food, see, it's getting cooked. Here it is raw. Here it's in the pan. Okay. And one more very important thing. Hot. Okay, hot. Except gastric will be better by hot. Okay. Anyway, we'll come to it. Now, it can also be thought of in children for fever, frequent cold, infections with enlarged glands. Okay. And what is this? What is this? Use your common sense and answer. More than open. A appreciate. It's in open. Okay, walking. What do you think will happen to the walking? Very good, good. Why late walking? Yes, something beyond that. Mother is giving nutritious food, but what is happening to the child? That is not getting absorbed. So, it is affecting the growth. So, walking can be delayed in Silicea. Okay? Delayed walking, yeah, improper absorption and assimilation. Okay. What is this? Yeah, very good, constipation. And you know the character of stools in Silicea. It is hard, knotty, and you know it's not coming, it has to be removed mechanically, or it just comes and goes. Possible, receding stools. So, this is what you have to write when there is a question, and it's a possible question for you in your exams. Describe a typical Silicea child for 5 marks. So, itna sab likhna padta aapko. Okay, and please remember the headings. What will be the headings? Physical appearance. Okay, mental makeup and physical makeup. Okay, mental and physical makeup, and particulars, meaning bodily complaints. What exactly you see? Desires, aversions, ear pain, throat pain, frequent cold, cough, okay, constipation, all those things you can mention. Though I will provide you a written note, but these are the headings you need to remember. Okay? Now the last part of Silicea will be what? Modalities. What aggravates, what aggravates. What aggravates, you know by now. Silicea is what type of a patient? Thermally? Chilly. Very good. What do you mean when you tell chilly? People who cannot tolerate cold. अभी देखो बैंगलोर में बारिश आ रहा है. बैंगलोर का मौसम थोड़ा ठंड हो रहा है. तो if you are Silicea, if you are chilly, हमें स्वेटर दो. Fine. So I mean you will be packing yourself. इधर ग्लोव्स उधर ग्लोव्स सब डाल के दरवाजा बंद करो, इधर बंद करो, वो बंद करो, ए फैन बंद करो, पंखा बंद करो. Fine. अगर आ गए तो आग लगाओ. देखो गरम चाहिए, गर्मी चाहिए. Right? So what you need to understand is Silicea is a chilly patient. So as you rightly told, cold aggravates. Is it only cold that aggravates? What also aggravates is? Where is physical? What is shown there? Mental. It's brain. Brain is put under. Just like brain going to the gym. Brain is put under a lot of pressure. Mental exertion. Mental exertion. Okay. Studies. Noise. Walking. Cold weather. And what is this? Moon. There is something called as new moon, full moon. Okay, fine. So moon can have issues. There are so many people who have issues. Sir, Amavas ke raat, Purnami ke raat. Fine. This lady acts weird. Okay. Then you have seen a lot of movies. So Silicea has aggravation with moon. Okay. And during menses, and what ameliorates? See, I mean, there are a lot of things which you can decide. When you say cold, here it will be warm. Okay. So very simple. Now why did this day come? We wanted warmth and naked. Yes, in brackets what are they putting? What is that is getting ameliorated by profuse urination? Very good, headache. So headache, okay? Good. And what is this? Under head I told you, wrapping something tight. Pressure, wrapping something tight can ameliorate. And very important is cold things, ice creams. And except gastric. Gastric complaints are better by warmth. Other complaints are better by cold. Okay? And better by warmth because it's chilly. See, a few days back I had a patient calling from Hyderabad, a very good patient of mine, and she had a bad nausea. And Dr. Saab, ulti bhi ho raha hai, ulti aane jaisa ho raha hai, and she was in Hyderabad and I am in Bangalore. कुछ prescribe कर दो, मैं लूँगा मेडिकल में. So when we started asking her more, kab jada, kab kam, that's a big funny thing I noticed. What is that funny thing? ये जो उल्टी होने जैसा होता है ना, जब मैं आइसक्रीम खाता हूँ ना, तब बंद हो जाता है. मतलब I don't feel nauseous when I eat ice cream. Then, so in homeopathy we have 5 remedies, in which nausea better by eating ice creams. उसमें एक रेमेडी निकाल के उनको फास्फोरस दे आता है. Okay, and by evening she messages and telling, thank you sir, nausea is almost 80-90% gone. And that's, why I'm trying to bring in small cases for you is only to motivate. Ki if you give a right remedy, it can do wonders. And luckily I got a very characteristic symptom. खाना नहीं खा रहा हूँ मैं, खाना नहीं खा सकता हूँ मैं, because when I see food, when I eat food, right? But I observed when I eat ice cream, मेरे को नाज़िया नहीं है. Then, so that is what was told by the patient. Okay. So at the end of the session, are you clear with my objectives? We spoke of the characteristic symptoms. I told you particular symptoms. We have done the modalities, and you will have some assignments. Just make a note. At the end of the assignment, you will be able to. So this is the assignment part in Silicea. List 4 eye symptoms of Silicea. See, Silicea has lot of things, and according to the new syllabus, I cannot cover everything. So there is a concept called as assignment, where students and teachers will equally share the burden. So what you need to do is, after the class you have to go back, I'll give you the books that you need to refer. List 4 eye symptoms of Silicea is an assignment. List 4 nasal symptoms of Silicea is the second assignment. And third, list 4 female symptoms of Silicea and list 4 respiratory symptoms of Silicea. Okay? I have tried to cover important points, and the other important things I have given you as a small assignment. Okay? Now a final question, which can be a Viva question, and if you are lucky it can be a theory question. What is this final question? Which remedy is called homeopathic surgeon? So this can be an MCQ question. Rota, arnica, Silicea and Symptom. 4 options. So you need to take the right thing. And you know now Silicea. Now the next question that can come up in your Viva is, why is Silicea called surgeon's net? Why? Okay, good. Because of its nature, character of separation. Good. Anything beyond that? It helps in expelling small foreign bodies. When I say small foreign bodies, what did we discuss in the last class? It can be a small gravel, it can be a small wood piece, it can be what? It can be not fish. I told you, it cannot be the entire fish. Fish bone. A small fish bone is stuck. Okay, and Silicea can do wonders. And many surgical conditions like fistula, fissure, phelon, keloid, these things can be treated without surgeon's help. So it is justified that Silicea is called the homeopathic surgeon. If it is asked in Viva or in your clinics tomorrow, you need to remember. Okay. Now before I close Silicea, the key points. It's a deep-acting remedy. From head to toe, you see Silicea acting everywhere. I have given you the must-know areas. Okay, fine. And I have also given you a few areas that you should know as assignment. Okay, done? So in exams, you can have multiple choice questions, or you can have 5 mark question. Describe the gastric complaints of Silicea, list the characteristic symptoms of Silicea, or you can also have a question like describe Silicea child. Or justify why Silicea is called as surgeon's name. It can be any of these things. Or it can be many more. I have just given you few in the flow. Okay? Any quick questions in Silicea? Anything you want to ask? Get it clarified? All fine? Okay, brilliant. So thank you. So, must be after this, we'll discuss tomorrow's periodical assessment. How exactly it will be done. I'll just brief you. Okay? Yeah, thank you so much. We'll close this class.